The story.
Good day and welcome. Straussburg is about 10 kilometers from Upington in the Northern Cape and about 400 kilometers from Kimberley, the Northern Cape's capital. It's a small town with about 4,000 people, of course surrounded by a number of table grape farms. So lots of farm laborers living in this area in a community of about 4,000. Other people are of course dependent on SASSA grants, and so not a lot of them can afford healthcare, and so they are dependent on this clinic where we are standing now. So the Straussburg clinic, it's a mobile clinic coming twice a week to this area on Tuesdays and Thursdays, and then operating from this building, which of course was a church in the past. As you can see, some of the pews are still here, and this is actually the examination room where the nurses and the health professionals conduct the examinations. To talk to us about this, we have one of the residents and actually one of the healthcare professionals. You do conduct HIV counseling.
Yes, I'm a HIV counseling here, and we assist the clients here in this church from 2009. We are here busy with the clinic, mobile clinic. The clinic is coming from Leerkrans with a bakkie, and then we put all the staff inside this church, and from this church, the people, we serve the clients here. And I begin in 2004 with healthcare, and then I go up for a counselor, and then I am now a mentor, and I do till today. I'm serving the clients here in this church, and that is unhygienic for me to work here, but here is not privacy in our clinic. So what I want from the government is our own clinic here in Sikalelo in Straussburg, and I want my own counseling room there that I must serve the clients. In this room, we sit here and we test the clients here. And when sister comes, sister sit in front of there, she bring her own table to sit there. And when she's busy with the client, she serve the client there. And when the maternity woman coming in here, that sister will serve, they laying there on the bank. And sister do the observations there. And in the other room, the nurse is there. And the nurse do the observations there. And our medicines come in boxes. And the boxes stand there. And outside this room, there is a bank. All the files is there. And from there, the files is coming in. And from there, the people will serve. But for me, as Sandra Titis, community healthcare worker, HIT, a mentor, is it unfair to serve our community here in Straussburg? So my plate today, the counselor was the 26th of May here in our community, and she promised us that she must go back and she must go to healthcare, and to us that they must make it immediately to give us a clinic that we must serve the people there. So I asked the government to come and see what our clients, our community is going through. And I'm working for North Cape Fox Forums in Upington as an NGO, and also I work for Women on Farms, that I must look for all the people, all the women in our community, that they must get property health care service. But in our community, is really unfair, is unhygienic, it's not right that we must take care of our clients in this church. So my plea is today, come, let us take hands and help us as community here in Straussburg.
So when you do the HIV testing, and then you discuss with your client or with the patient, obviously there's some counseling before, and then you do the testing, and this happens within the vicinity of other people. Obviously there are issues of privacy, obviously there are issues of dignity for that person that you are testing.
So the persons feel not right because of I sit in front of our sister here. It's not a room for me, but I test here. It's not privacy here. But because my sister sit in front of me, because before I test, I must do a counseling. And after I test and give the results, I must do also a counseling to this client. And when sister is busy here with a privacy talk of privacy client here, I must go outside and go there and look for me, look for a place that I must feel comfortable.
Now, this issue has been around for more than 15 years. Have there been any discussions? Has the health department come to this community and said that this is what we are planning to do to alleviate the healthcare situation?
From my concern, I doesn't hear from them anything, but the 26th of this year, the councillor, Ulrich Hendriks, speaker of David Kruiper municipality, tell us I uplift the issue of our clinic, and then she take it from there and she tells us that she will come back. She will go to the health care and she will talk with Mr. Max. And she will see from there, and she come back, and she will feedback for our community.
So what does the community want in terms of healthcare? Do they want their own clinic, and what sort of clinic do they want?
You know what? In 2010, me and my other colleague, we decide to build our own clinic without any help from community workers here, or counselor here, or of healthcare counselor there in Upington. We go to the farmer and we ask for help, and he said, yes, I've sponsored you 40 sinker, and he gave us a parlor, and they said, go and build your own clinic. And when we go to the meeting, the councillor of Wijk 14, they said to us, no, they doesn't want a sink clinic. They doesn't want a property building there. So from 2010, the things is, the building material is lying there at my house. And then the rain comes and it gets colder, and we go back to the boss who will give us the material, and they said to us, keep it for you. And then I'm very happy because I built my house with that. And so today I will tell you that the councillor of David Kruiper municipality, she told us that she must really immediate, she will come back with feedback.